Welcome to Best Care with Bestmed Medical Scheme, a mini-series dedicated to the well-being of your family. Our topic, deworming. Joining us, Dr. Coopoo, welcome.
Thank you so much.
So doctor, we cannot worm our way out of this one. I want you to tell us, what is deworming and what causes our children to have worms?
So deworming is, as it says, you are removing the worms from your child using medication. So kids get worms in various ways. It can be through eating undercooked meat, especially pork. The other method is that they catch worms from kids at school by not washing hands, especially after using the toilet. The other way is if they're playing in sand barefoot in areas where there are worms, they can get worms in that way.
And what signs as a parent should I watch out for that indicate a need for deworming?
All right, so your child may complain that they are feeling itchiness when they go to the bathroom. They may be losing weight. You may see that they're struggling with appetite. They may have lower energy levels. They may complain of tummy aches. So there are a few symptoms that you can look out for.
So doctor, what are some practical tips for parents when deworming their children at home?
Speak to your healthcare provider about the deworming schedule. It happens every 6 months, and it's to make sure that your child does not get worms because, let's face it, it is a common problem with kids.
Yeah.
Other issues to prevent is make sure that your meat and seafood is cooked properly. Teach your child the value of washing their hands, especially after going to the bathroom. Deworm regularly because kids will be playing outside in the sand and common areas to get worms like that. Make sure that they have a balanced diet to boost their immune system, and just watch out for the signs.
I mean, babies and tots don't enjoy meds on the best days. So how can I, as a mom, make deworming medication more palatable for my child?
So there are pediatric formulations, usually syrups, which are usually tastier or more palatable than tablets. So get those formulations. To try and get it to taste a bit better, you could mix the medication with something more tolerable, like maybe applesauce or yogurt. But certain medications can't be mixed with certain foods. So it's best to ask your pharmacist when you collect the medication if it's safe to mix with certain foods.
What precautions can I take to prevent reinfection after deworming?
So the most important thing is to maintain the schedule of giving your child deworming medication. Even though you may have treated your child's deworming, they will be exposed continuously to the risk. So as long as you keep to the regular deworming schedule of every 6 months, your child should be fine.
And are there any side effects that I should be aware of when it comes to deworming medication, and how can I manage them?
So some children may get a bit of an upset tummy, may feel a bit nauseous, maybe they might have a bit of diarrhea, but it's minimal side effects and it's usually not serious. So you can just give stuff to comfort your child.
One last question before we wrap up. Are there any misconceptions about deworming that you would like to address?
So the misconception is usually that once you deworm your child, you don't need to do it again. Children are continuously exposed to getting worm infestations, so keep doing your deworming regularly, and that's the most important thing.
Thank you, Dr. Coopoo. Remember, when life happens, you need a medical aid that cares. Thanks to Bestmed Medical Scheme for yet another amazing episode of Best Care.